Shadow Health Secretary Jonathan Ashworth joins me now from Leicester. Jonathan, thanks for joining us. I just have to say, what's your reaction to all of this? Jump in wherever you feel appropriate.
Sure. Well, Matt Hancock he's done the right thing for himself, but more importantly for the country and the National Health Service. And although my dealings with Matt Hancock, he's always been personally extremely courteous with me, and on a personal level, I send him my best for the situation he finds himself in. But to be frank, given what happened, Boris Johnson really should have sacked him yesterday. And I think it shows a lack of judgment, a lack of guts, a lack of spine on Boris Johnson's part that he didn't act yesterday to sack Matt Hancock. In a pandemic where we need people to adhere to the rules, we cannot have the number one rule maker, the man who writes the rules in the Department of Health, breaking them in the way that he did. There's other failings about Matt Hancock's tenure as the Health Secretary. He failed to protect care homes with tragic consequences. He sent our NHS staff to the front line without PPE to face a ferocious, deadly disease. So there's been a whole host of failures these last 12 months or so, but Boris Johnson should have acted sooner. And the fact that he didn't, I think, speaks volumes about his lack of leadership.
From now on, you'll be sparring with Sajid Javid, who's been announced as a replacement for Matt Hancock. What's your reaction to the government's choice of the new man in that role?
Well, throughout my time as Shadow Health Secretary, I've always been the voice of patients, and we've got 5.1 million people on the waiting list. We've got people waiting for cancer treatment because their scans were delayed, or some vital treatments like chemotherapy and radiotherapies were delayed. We've got young people struggling to access mental health care, sometimes when they're in very, very desperate circumstances. So my challenge to Sajid Javid is, what are you going to do to deliver the healthcare people deserve? And my worry about Sajid Javid is that, of course, he was the Chancellor of the Exchequer, and he didn't give the NHS the funding it needed, and didn't reverse some of the deep cuts to healthcare that we've suffered in this country. So that isn't a record that inspires me, and it worries me. But I'll be putting these questions to him, I'm sure, very soon in the House of Commons.
Something that has occurred to me as this long story of the pandemic and COVID has unfolded is, it seemed to me that for decades we were being preached at about the importance of staying on top of getting tests for treatable cancers, maintaining our health, maintaining and talking about our mental well-being. This was as though this was the absolute priority of governments of different stripes for as long as I can remember. Really, all of it was set aside for COVID. Almost overnight, COVID-19 became the only thing to be afraid of, and I think most of us well understood for personal reasons that there were plenty of other things to be frightened of. How does any government go about getting back to where we were and taking the rest of the threats to our health and well-being seriously? I mean, how much has been undone by this single-minded, blinkered, obsessional focus on one way to die?
I think we should never have got ourselves into a situation where we were forced as a country to essentially make a choice between cancer care or COVID care. But we were in that situation, and you may expect me to say this as a Labour politician, but we were in that situation, I believe, because for 10 years, if you do not invest sufficiently in your national healthcare infrastructure, it meant when this crisis hit, we had lost 15,000 beds over 10 years. We were short of 40,000 nurses. Our social care sector has been neglected for generations, to be frank. I mean, that's not a part of political one. I mean, governments have not given social care the priority it deserved. So when this crisis hit us, they had no choice but to empty beds quickly because they needed the beds, to pivot all the staff to dealing with COVID care, which meant a lot of cancer scans went by the wayside. Because of social distancing in hospitals, we've actually got less general and acute beds now as well. So even the beds, we've had more bed cuts on top of that. And you're right, what we need to do is get back to a situation where, yes, we treat COVID and we treat it appropriately, because even with vaccination, There will still be people who get COVID, sadly. That's just biology. But we've got to get back to treating cancer, mental health. And the problem at the moment is we've got a massive backlog. I mean, there are 2,000 people waiting over 2 years for treatment. Can you imagine waiting over 2 years for an operation? Waiting over 2 years in pain and anxiety. We are facing a huge backlog in clinical care in this country. And the sooner we start tackling it with a proper plan, the better.
It seems that you might say that at the moment, and for the longest time, we've had a national COVID service rather than a national health service. Do you understand the anger that is being reflected from the electorate, from the general public, about the path that all of this has taken?
Well, I think though you've got to. Well, maybe I can sort of see that we might have disagreements about some of the lockdowns and things like that, and that's fair enough. It's important that these issues are properly discussed and interrogated and challenged. So I don't complain about that. But I still think that we've needed restrictions to try and drive infection rates down. But I can totally understand the anger about not being able to access levels of care that people want to access. I mean, it's difficult to see a GP at the moment in person. That's because of all the infection control measures in place in family doctors' practices. And we know that a lot of people missed out on vital cancer scans. And with cancer, the sooner you detect it, the better. I mean, that's the answer to a lot of the cancer issues, is getting early diagnosis in. But of course, a lot of that has been delayed. And the thing that's really upsetting me and concerning me, I'm a parent of two young daughters, but I obviously think this as a parent or not, is that we know that there are so many young people who've really struggled with these lockdowns. They've struggled not being in school, and we can see, sadly, the impact that some of that is having on some of our more vulnerable young people in terms of mental health. And we really need to get quality mental health care to our young people in this country.
Stay with me now, if you will, John, just while I'm just hearing that we can go to Conservative MP Andrew Bridgen, who joins me now. Andrew, within the Conservative Party, is there, well, what's the mood? Can you sum up the reaction to the revelations of the past few hours and days?
Well, I think Matt Hancock's done exactly the right thing for the country, the people, the Department of Health, and indeed the government. It doesn't matter if you've got the confidence of the Prime Minister and your colleagues. Ultimately, every Secretary of State has to have the confidence of the people, and none less than the Secretary of State for Health during a pandemic. And what became clear is, as Matt Hancock apologised for breaking the social distancing rules that he'd been instrumental in implementing and deciding upon, was the apparent perception of hypocrisy. That lost public support for him and his position, and without that, his position was completely untenable. It'd be untenable for any cabinet minister not to have the support of the public and confidence, and absolutely impossible for the functioning of a Department of Health secretary during a pandemic.
Clearly he was left with little option, you would reasonably say, but to resign. But I really meant the mood within the party, having had to witness, courtesy of the Sun newspaper, the health secretary supposedly leading us through a pandemic, skulking around the offices of his department, waiting for some special time alone with one of his aides paid for by public money. What's the mood in the party about that kind of revelation?
Well, I think people were disappointed. I mean, clearly, politicians are entitled to a private life. I think this was more than that. I said yesterday that if Matt Hancock felt that the relationship he was in had undermined his ability to perform his function as a crucial function as Health Secretary, he should have resigned. And if the Prime Minister felt that his ability to perform his function had been diminished because of these events, then he should have sacked him. Clearly that wasn't the case. But then ultimately, as I've already said, it's okay for Matt Hancock to have the confidence of the Prime Minister and his colleagues, if he hasn't got the confidence of the majority of the public, his position is untenable, because we're in a pandemic. The public have made huge sacrifices, taken rules and regulations in part set by Mr. Hancock, and once they discovered that he'd broken his own rules, his confidence, the confidence of the public in his decision making, and any future decisions he'd need to make was fatally undermined. And that meant his position was untenable.
John, if you're still there, what does this do? What does this do to Westminster, to the Conservative Party, and to the Labour Party? I mean, surely there's an extent to which this is, shame on both your houses. How is public confidence in the progress through this most difficult of times to be regained? Who do the public look to for the kind of leadership that's required?
Well, look, I mean, I like Andrew, and I think the public don't give a monkeys about Matt Hancock's private life, and people have the right to a private life. The problem for Matt Hancock on this was that not only does he design the rules that I happen to have broadly agreed with, I think Andrew has probably disagreed with some of them, but I broadly agreed with them, but also Matt Hancock, when others were caught breaking the rules because of circumstances in their own private lives, he was very finger wagging about them. I mean, if sometimes when people break the rules, you can say, well, they shouldn't have done it, but maybe they've got it's not for me to get involved in their private life, and you don't know what goes on, sort of thing. But no, he was very sort of moralistic about it, and I think that hypocrisy is particularly stuck in the throats. And I've certainly had a lot of constituents emailing me in the last 24 hours pointing out that they've not been able to attend funerals of loved ones, or they've not been able to see, or they weren't able to hug their mum for considerable amounts of time. So I think this has been very damaging in that respect. Politicians, of all parties, we all just have to do our best, and we have to show that we are doing our best. But in these circumstances, and also because of the failure to protect care homes and the PPE, I don't think we had a health secretary who was meeting the expectations of the British public.
I would say it's a bit rich to be talking about the necessity to respect a politician's privacy at a time when there have been such erosions, so much meddling with all of our private lives, and we've been invited to set aside the issue of privacy. Things like health passports, having to divulge to whoever the nature of whether people have been vaccinated and other details about their health. Doesn't the fact that that Mr. Hancock now has to have his privacy respected not underline the necessity that all of us have our right to privacy respected in so many aspects of life?
Well, I think that's why there's a lot of anger about what's gone on here in these last 24 hours. I mean, I still think that some of these restrictions that we've had in place and remain in place have been vital to help us get on top of this virus. But I've always been acutely aware that politicians have been restricting liberties of people in a way in which is totally unprecedented, perhaps other than maybe wartime. And that if we are restricting people's liberties, then we have a duty to be responsible and to understand that, and to only do it in the most exceptional of circumstances.